We are entering our 38th year of being in existence at Queensway Carleton Hospital. And I know I've mentioned this before a few times, but I had to muse this morning when I got up because I heard this actually several times from Aubrey Moody, who is one of the, if you will, founding fathers of Queensway Carleton Hospital. And I know he said that when they were advocating for development of the hospital, people really did ridicule them and laugh at them for saying, "Are you crazy developing this hospital in the middle of no place? Just fields around us." And looking at Dan, he reminds me of that famous Gretzky saying that how true that is, because most people will look at where the puck was. Some will look at where the puck is, but very few in the special will look at where the puck is going. And certainly that group of folks definitely were those special few that could see where the puck was going, because if we look around us, the population growth here has been phenomenal, and certainly we are not in the middle of no place anymore. We're surrounded by, actually, I'll call it a lot of communities and a lot of people. I do want to extend a thanks to each and every one of you, to our communities around us, because as Steve, you mentioned, actually our programs now have a regional reach. They're no longer just the local community as well. But also to our governments, both liberal and conservative, the staff, physicians, and volunteers that have made it possible for Queensway Carleton Hospital to go on this journey over the last decade and a half of redevelopment so that we can actually provide the top quality care to those that need it. And if you permit me, I'd just like to do a bit of a highlight down that journey. It really began in the late 1990s with what was called the Ontario Health Services Restructuring Commission, whose mandate was to integrate and consolidate hospitals and hospital services. So our first phase involved the integration of the maternal child program, which we hadn't had at Queensway Carleton Hospital, to ourselves. And I have to say we were very proud and pleased to receive that program, because I know many of you in this room either were born there or know people that definitely were born there. So it provided us a program with a great reputation and a foundation, and we're very pleased that we've been able to grow that program so that now we birth about 2,500 babies a year. That's a lot. And we opened up just a couple of years back as well with approval, what's called a level 2 special care nursery for preemies and those babies that have special needs. And it's interesting to think as we go through this journey, that was also the time that we received our first CT scan. We had other modalities, but that was the first real major piece of diagnostic equipment that we were able to receive. And I do, seeing around in the room, we have a couple of volunteers, and I want to acknowledge that that CT scanner was primarily funded from the proceeds of our volunteers. That's a lot of bake sales, a lot of draws, and everything else. And a lot of people have forgotten about that. Then in about 2005, we opened up what's called Phase 2, and that is the East Tower. And on the ground floor, we were able to move into an emergency department about double the size of what existed before. And I do want to backtrack because, and Dan's father was instrumental in this. They had that vision that Queensway Carleton had to expand, but it had not occurred, which is unusual for hospitals over essentially a 20-year period, even though there was a lot of growth. And some of the desperate needs we had were in emergencies. So if folks here can remember, we literally, and I'm not kidding about this, had to divide cubicles in half and put patients on both sides. And we sort of joked that we need to only hire thin staff because that's the only people that could fit in between the patients. But I know my clinicians here, that honest to God is the truth. So we were delighted to be able to expand the emergency department because, again, it was built for maybe about 30,000 visits a year, and we were serving 50,000, 60,000. And today we're over 70,000 visits a year. So we are the busiest emergency department in actually Eastern Ontario. As well, on the second floor, another critical area, no pun intended, was we had to expand into a new area with our intensive care unit, and that tripled in size because before it almost was like a makeshift ICU. It was a state-of-the-art, it still is, it's a state-of-the-art facility, and it also involved us changing to much more complex, advanced structure where it's only staffed by intensivists or specialists. So it truly serves as a regional resource for Eastern Ontario, and in fact, sometimes we have other imports from outside the region as well. Along with what I mentioned about the tremendous demand on the hospital, we were able to add an inpatient unit, which again was desperately needed because our hospital was continually running at 110, 120% occupancy. That means that a lot of people were in corridors in the emergency department, et cetera. And that definitely is not patient or family-centered care. It's unfortunately, it was a reality. And in fact, we're pushing that envelope even now today again. But those inpatient beds were extremely critical. On the third floor, we added a brand new program to the hospital, and that was acute rehabilitation. And I see Mary here because that was really donations too by what you'd astutely been able to operate, I guess, through Nepean and have as a reserve as well, too. I don't know if I should be bold enough to say, Jim, there's a lesson for you. But you're not Ford, so we're all thankful for that. Anyway, this is a friendly crowd, so I can say that. I think at one time I did laugh, Jim. I think the biggest thing was you were at a philanthropy dinner and we were saying, thankfully, Jim is more low-key and everything else, too. So I really mean that honestly, too. Anyway, also at that time, it was another big step forward diagnostically in that we were able to add our first MRI unit to Queensway Carleton. At that time as well, too, this was a very exciting time and not a surprise, but we're a little surprised, too, that it actually moved along. We received approval to build the Irving Greenberg Family Cancer Center. And that really meant shifting services from the civic campus. The buildings were very old, and it was too expensive and not worth renovating. So the program was really shifted to Queensway Carleton Hospital, and that provided, I think, 31 chemotherapy bays or stations and 3 radiation bunkers, as well as a lot of support facilities. And I know, too, a lot of people have been so happy that it's been located in the West End because it just made it so much easier. And we do now regionally focus on 3 areas of cancers. That's breast, colorectal, and prostate cancers. Phase 2 was quickly followed by Phase 3, and we built the West Tower, which is now known as the James Beach Family Health Center. And I will say the second floor totally allowed us to redevelop our surgical program. It involves 10 new operating theaters, recovery rooms, and a lot of associated support spaces. On the ground floor, we're able to expand our ambulatory care clinics, which cover a myriad of programs in medicine and surgery, and people come there for diagnostic purposes as well as treatment. We're able to open up a new expanded rehabilitation area for physiotherapy, occupational therapy, and speech, and I think a lot of folks are like myself. I know I've just recently benefited from their services. They're a great group. And last but not least, we were able to open up another new program for the Queensway and the West End, and that is dialysis with 15 stations. Most recently, we've been able to redevelop some of the original chassis of the hospital, so we were able to relocate pharmacy and diagnostic imaging. And pharmacy entirely and some of diagnostic imaging were the original 76 infrastructure. And I've said this a few times, just close your eyes and imagine Nepean or Canada, if no infrastructure would have been added since 1976, even though you had growth. That's the analogy that we were really going through. And it certainly was not patient or family-centered in that we didn't just have waiting areas that were appropriate for the volumes that we were putting through. So now those areas are properly sized. Another area that, it's not direct patient care, but actually it is very much patient and family-centered, is that we're finally able to provide a new front entrance where families can either wait for their loved ones or for pickup and delivery. And to some it may sound small, but it makes me smile every day when I come in to see how many of our patients actually are looking a lot more comfortable and have a place to actually relax a little bit, like I said, when they're waiting for their loved ones. Just 2 weeks ago, we were really delighted to have the Premier visit the hospital and announce the approval for the acute care of the elderly unit. We had some foresight. We knew we needed some additional inpatient beds, as I said, because of the continuing growth and aging of the population. And so now this unit will be actually located on the 3rd floor of the James Beach Healthcare Center, which was shelled in. And it's from folks like yourself that we were able to go to government and saying, we'll put in this money ourselves to be able to build the shell for that floor, push the building up, which is a lot cheaper than doing it after the fact. And so now we can go forward and actually finish that off. It will contain 34 inpatient beds. And more importantly, I know I have a couple of my leads at this table in front of me for that program. It's not just the physical environment that'll be very conducive to this population who typically has 3 to 5 chronic illnesses. They are really what's referred to as the frail elderly. But it's the concept of the staff that'll be holistic from moment one. We want to pull these people in from emergencies so they're not in a medicine bed, which is appropriate for people if you're coming in with a pneumonia or whatever it is. But for these folks, they have so many complicated issues that we want to pull them into this specialized unit. And as some of you may have heard, this will be a model program for other hospitals in this province. Mount Sinai has a similar program, and we're taking lessons learned from them as well too, but we really will be unique, certainly in Eastern Ontario, but for the province. So we're really excited. And if I tell you that over 70% of our medicine inpatient folks are over the age of 65 and the majority are actually over 80, 85, you'll certainly, I think, appreciate how critical it is that we introduce absolute leading best practices because Queensway-Carleton Hospital has been a leader in acute geriatric care. And we have to be, because that is the majority of our patients, and that's actually the majority of most hospitals' patients as well. So we're really excited about that opportunity. So in summary, we are very proud, very, very proud of our new facilities and the associated equipment. However, we need to continue this journey to truly be able to ensure that we can deliver on our vision of being the hospital of choice, recognized for our exemplary patient care, people, and performance in an environment of innovation and strategic partnership. And it is imperative that we continue to improve and enhance our infrastructure, because as much as there's so much added, there's still a very significant part of the hospital that is 1976 vintage and is very, very constraining on providing modern care. But in addition to the infrastructure, of course, we have to continue on for the improvements with technology and equipment, because we need this to optimize our skills and talents of our staff, and again, to promote an environment that truly is patient and family-centered. So I want to thank again each one of you in this room, because you have been instrumental in the growth of Queensway-Carleton Hospital, which has grown to be one of the most respected and clinically recognized hospitals in the province. And I know with your continuing support, we will be able to attract and retain the best and brightest as we have been doing.